How does your nervous system limit your flexibility? Imagine your body as a machine with safety sensors that keep you from overstretching and injuring yourself. That's exactly what your nervous system does. It controls how your muscles and joints can move safely. When you stretch, sensory nerves called proprioceptors are constantly checking muscle length and tension. If they sense you are stretching too fast or too far, they send signals to your brain and spinal cord. Your brain then responds by tightening muscles or creating a feeling of discomfort. This response is called the stretch reflex. It acts like a protective brake, stopping you from overstretching and risking injury. Special nerve endings called muscle spindles and Golgi tendon organs are key players here. Muscle spindles detect how quickly and how far a muscle is stretching. When they sense rapid or excessive stretch, they trigger the stretch reflex. This causes the muscle to contract, resisting further movement. Golgi tendon organs monitor tension in the tendons and can signal the muscles to relax if tension gets too high. These sensors work together to keep your joints safe. Your brain also processes signals from these sensors. When stretch limits are approached, it can increase feelings of discomfort or pain. This makes you naturally want to stop or ease off. This neural control is why flexibility isn't just about muscle length. It's also about how your nervous system perceives and responds to stretch. Research shows nerves themselves can limit movement. For example, the sciatic nerve, which runs from your lower back down your leg, can become stiff or irritated. When nerves are less flexible, they can restrict joint movement more than muscles alone. This is why some people with nerve issues find it hard to stretch fully. Interestingly, when people are under anesthesia, their nervous system's protective responses are suppressed. They can often do splits or stretch further than usual. This shows that neural factors are a big part of why we limit our flexibility consciously. For millennials interested in staying active and healthy, understanding this means that improving flexibility isn't just about stretching muscles. It's also about training your nervous system to tolerate more stretch safely. Slow, controlled stretching, combined with techniques like proprioceptive neuromuscular facilitation, can help your nervous system get used to greater ranges of motion. Stretching also influences your autonomic nervous system, which controls involuntary functions like heart rate and relaxation. Gentle stretching can promote a state of calm, reducing muscle tension and making it easier to move freely. In short, your nervous system limits your flexibility by sensing potential harm and activating protective responses like muscle tightening and discomfort. This helps prevent injuries but also sets boundaries on how much you can move. To improve your flexibility safely, focus on both stretching muscles and gradually training your nervous system to accept more movement. This approach is especially helpful for maintaining mobility and preventing injuries as you stay active.